Hey guys, my name is Nick Sivrich. I'm a physical therapist and I want to go over this week's question of the week. This week's question of the week is about the ACL, and I get this question numerous times from athletes and people that like to run is, hey Nick, when can I run again? And that's a really good question because, the ACL is one of the 4 stabilizing ligaments of the knee, and it prevents the shin bone, your tibia, your shin bone, from transferring forward during any type of cutting movement or stopping, especially during any type of sport. And, the primary focus whenever you come to physical therapy after ACL reconstruction is really to get your range of motion back, get the swelling back, and then obviously you start on strengthening. And usually that happens within the first, 8 to 12 weeks of your rehab. That's kind of what we're focusing on. Usually I start people running anywhere between 3 to 3.5 months, depending on their symptoms, depending on what they're trying to get back to doing. If it's a high-level athlete, someone that really wants to or really needs to get back to that, usually I'll start them around 3 months. If it's someone that normally just jogs for exercise or runs for exercise, things like that, isn't really cutting all that much, usually that's about anywhere, 3.5 months or so. And then shortly after, I'd say anywhere around the 4.5 month range, 4 to 4.5 months, that's when we start some more plyometric activities, cutting, jumping, agility ladder type of things. It can be done a little bit sooner, and different surgeons have different protocols that they want you to specifically follow. But normally, I've been doing this long enough that they kind of leave it up to me. They kind of trust me as far as, what I think is best for the patient. And agility in that is usually done around 4 months, 4.5 months or so. And, sometimes, you can get the patient back, the athlete back as early as 6 to 8 months into their regular regimen of, what they do for training for their sport. So some it takes a little bit longer, 9 months, sometimes even a year. It used to be a long time ago, you used to not be able to return to sport till after a year. And things have kind of shifted downwards a little bit, that you can get them back a little bit quicker. And sometimes they'll have a brace that they get fitted for and things like that. But for the most part, that's kind of when you start running. And usually it's just a jogging, walking, jogging, straight plane movement type of running. You usually don't cut back and forth side to side until maybe the 4.5 month period. So I hope that helped this week. I hope you got some value out of that. If you have any questions or concerns, feel free to contact me. Have a good day, guys. Thanks a lot.